Perfect. Thank you very much for having me. I'm Christian Hens, Universal Diagnostics Managing Director. 40% of all of us in this Zoom call will develop cancer in their lives. But we don't know who, we don't know where, and we don't know when. The only solution to that problem is detecting cancer and the pre-cancer stage early so we can have much higher treatment success. That represents a huge opportunity. The cancer diagnostics industry today is $250 billion in size and growing by 7% every year. Now, the holy grail in this is detecting it early, preventing cancer with a simple blood-based test. And that's what we're trying to do at Universal Diagnostics, making cancer curable by detecting it with a simple blood-based test. If I want you to take one thing away from this call today, we're number one in early detection and prevention of cancer. And we're focused on colorectal cancer primarily. Now, we've presented our results at leading conferences globally. The last one at the beginning of this year at the Association of Cancer Research in the United States. 77% sensitivity in colorectal cancer and 88% specificity with our biomarker blood-based test is much better than any commercially available test right now there in the market. But what's even more exciting, we're also available to detect the pre-cancer stage. 62.5% sensitivity and 87.5% specificity is absolutely unique. And it means disruption in healthcare because we can actually prevent cancer altogether, reducing incidence rates. How do we want to commercialize the test? Very simple, very straightforward, integrating it with existing lab floors. That means working with clinical labs, running the tests on commercially available equipment, uploading the raw data to the cloud, where we then run our algorithm and provide the results of positive or negative. Positive means you should go for other additional diagnostics like a colonoscopy, which is invasive, or negative, you come back in 1 to 2 years and we do the test again. What makes me really exciting beyond that is that we start to see that our approach also works on other cancers. We've just presented at September this year at ESMO GI the results on lung, breast, and pancreatic cancer. And you see that the stage 1 detection that we achieved there of 75% is absolutely mind-blowing. So let's bring it together. We're number one in early detection colorectal cancer. We have proof to detect other cancers. We work with the 80 hospital network globally and have a key opinion board that supports us. Where do we take it now? Commercialize the test, develop lung cancer and pancreatic cancer tests, and build UDX globally. All of that driven by a top management team that has IPO and NASDAQ experience. Thank you very much.
Thank you, Christian. So, dear judges, let's move to Q&A session.
Christian, can you tell us maybe once more about the evidence that it really works? I see that you are working with 80 hospitals, yeah?
Yes.
And these are pilots. So this.
Yes, so we've collected 12,000 blood samples and we're running these in the development of our test. And what shows you that this works are studies and publications like this that we did together with Stanford University, where we take a test set where we look for our biomarkers, develop our algorithm, and then validate it on a completely independent set where there's no overlap with the training set. So it actually gives the real results, and we always compare us against the gold standard, which is the colonoscopy. In that way, we always know if it works or not, and that's how it was done. So yes, it works.
Yes. Okay, and I saw in your profile that you have already raised 30 million in the last round, yeah?
Correct.
Or before. And what was the evaluation?
I would prefer to take that to a private conversation later on.
Okay, great, no problem.
But thank you for the interest. I'll take that down.
Lilia?
Yeah, thank you so much.
Thank you.
We have actually 1 extra minute for a Q&A session. Dear judges,
I have a question, please. So what is the false positive and false negative in your study? When you are doing these tests, how many turn out to be positive by your study and then they are negative?
Yes, that's a very good question. So our essentially that's how we measure our test performance. We are right now at 77% sensitivity, 88% specificity. That means out of 100 colorectal cancer patients, we are detecting 77. We are missing 23.
Mm-hmm.
Okay. Out of
Mm-hmm.
100 controls, meaning healthy patients, we identify 88 to be healthy. Okay. If you compare that with any other test that is out there right now, sort of non-invasive tests, of course, that is much better than anything there is. It's a little bit worse than colonoscopy, but that's the gold standard, and it's a massively invasive procedure that will be the consequence of having a positive results of the UDX test. Make sense, Hesham?
Thank you. So just to be sure that I understood you, what you are doing is essentially getting blood sample, and you are running some kind of AI algorithm, and you are able to detect with good accuracy that you have described already whether this person has this kind of cancer or not, just based on the blood test and just based on the neural network or whatever algorithm that you have developed. Is that correct?
Exactly. And you summed it up much better than I could ever do. Yes.
Interesting. Yeah, thank you. Interesting. I have no more questions. Thank you.
Hi, everyone. I just have a very quick question. First of all, great technology. I'm Luisa, representing Plug and Play here in MENA. I just wanted to know if you were familiar with a sort of similar startup that now has IPO'd, Guardant Health. Do you see similarities between your technologies?
Yeah, so I mean, there's certain similarities in our technology. The gold star product of Guardant Health is a test that is currently used in treatment guidance, okay? Mm-hmm. So it's a little bit later in the process where you look at if someone has been diagnosed with cancer, then the question becomes, how do we best treat that patient, okay? And the 360G test from Guardant Health focuses on providing the information, which mutation is present in the cancer patient, and therefore what type of treatment should you do? Chemotherapy, radiotherapy, etc. There's many different options, but that's the gold star product of Guardant Health. They recently said they would like to move into our space as well, and actually we're in contact with them because they find our advanced adenoma data incredibly exciting.
Great. That's great to hear then that you're working together. Thank you. No more questions.